Thanks for joining in. Now, today's trail on the global toll of infections and COVID-19 shows an increase of about 200,000, bringing the new total to 20,307,862. The death toll also climbed higher by about 4,000 from 737,000 to 747,731, while recoveries have been put at a little over 12.6 million. All figures have been drawn from the Johns Hopkins University's Coronavirus Resource Center. The top 5 countries remain the same, with 2 of them, the US and India, recording more than 50,000 new cases in 24 hours. Brazil retained stability at a little over 3.5 million, while Russia and South Africa added 5,000 and 3,000 new cases, bringing the new infection tolls to 900,000, a little over 900,000 and a little over 500,000 respectively. August 7th to the 14th has been designated World Mask Week 2020, that is. The homegrown theme for this campaign has, as designated by the NCDC, is Mask On Niger, as it is an awareness drive executed clearly to reaffirm the need for proper use of masks as a preventive measure against COVID-19. This comes on the heels of Malaysia's consideration of making public use of nose masks compulsory, while the debate on nose masks as an essential protective piece has been rife. Little has been said about the precautionary principles that should be adopted while the world adopted to the new normal. Your guess is as good as mine. Surely, this shall shape our talking points today on the program. COVID-19 is tasking the professionals and also their creativity of the healthcare providers. And this is global. And with the scarcity of ventilators to take care of so many patients, medical practitioners are finding new ways of helping symptomatic patients cope with breathing. Watch this.
Friends and families, as COVID has become so rampant and so difficult, I am taking this position to show you what are the things that we are doing today in the ICU to help a lot of our patients. If you look at my feet, you look at my knees, my elbows, and my position. This position that I showed you at the beginning of this video helps you to send oxygen to the lower part of your lungs. COVID will attack the lower parts of your lungs, seep out fluids that is as thick as glue, block the lungs, and lead to suffocation, literally, and respiratory failure. Many studies, without a shadow of a doubt, have shown that the best way that we can deliver oxygen is we, the ICU team, place patients in a position on their stomach. Then you drop your elbows like this and you put your head down and you breathe in deep and you cough. This is called proning. Proning, P-R-O-N-I-N-G, proning position. With this, I hope you stay safe. Yes, I am Dr. Rafai. I am a doctor here in Panama City, Florida, and I care for patients with acute COVID in intensive care units of all our hospitals.
So it's been nearly 6 months since the world became accustomed to wearing a new piece of accessory. That's the nose or face mask. But while the debate lasted, how much was said about the possible adverse effects of long use of these face masks?
Since January 2020, the COVID-19 pandemic has brought mostly gloom, with nearly 740,000 deaths reported. This destructive attribute of the disease has compelled an adjustment to normal life required for protection and prevention: nose masks. Governments the world over have recommended the public use of nose masks, particularly because the disease spreads through droplets if passed on between 2 or more persons in proximity. However, months down the line, some have begun to count the costs from the prolonged period of wearing nose masks, which doesn't appear to end anytime soon. Online medical journal ClinMed returned some results in a recent study titled Adverse Effects of Prolonged Mask Use Among Healthcare Workers. CleanMed's findings from 314 respondents reported adverse effects like headaches being the most common complaint, skin breakdown, acne, and impaired cognition. Among a more general population, a study carried out by a Rwandan website, Tarifa, provided similar outcomes with a few variations to include allergies, decreased immune system, sight discomfort, and difficulty breathing. 8 months down the line, it may be a little late to kickstart the discussion on the need for precautionary principles on the prolonged use of masks, but it is better late.
So joining me via Skype to talk on this is Adegoke John, who is a research scientist based in Melbourne, Australia. Thank you for joining in, John. Appreciate your presence.
Thank you very much.
Fantastic. Great. So, straight, how long do you think an individual should wear a mask for?
Thank you very much for having me here tonight. Generally, I think it depends on the nature of the nose mask. We generally have different type of nose mask available, and each of these type of nose masks have different durability. So I won't say there is a direct answer as to how long a person should wear a nose mask. I think it should be an individual responsibility to know when their nose mask needs to be changed. For example, if you're using the N95 nose mask, which is the N95 and the N99, which is like the most popular type of nose mask that is being worn around here, I won't use that for more than 2 days. Because by the time you go out, you already contaminate the nose masks already. And even the fabric-based type of nose masks, I know a lot of people will try to recycle it by washing it, because I understand the fact that, it might be quite expensive to buy these nose masks. But while doing that, you're actually increasing the pore size. And when you do that, you indirectly forfeit the purpose of the nose mask itself. So I would say generally to that question that it depends on the user to know when the nose mask is dirty enough or is no longer viable to be used as a nose mask.
Okay, so what are the scientific evidences we have that to back up the success of the use of the nose masks? Considering that the cases have increased over the years, or rather over the months, social distancing, nose mask, washing the hands and all of that. What scientific evidence do we have to back up that, hey, with the use of the nose mask, this can be prevented or this has been prevented?
Right. So generally, most of all these nose masks are made of cloth, fiber, except for probably the clinical-based one, which are made up of plastics, polyethylene. So generally, the cloth mask, which are used largely in the community, they reduce the number of microorganisms, that someone releases into the air. So generally, when people wear nose masks in an area, there is a fewer potential viral droplets will go into the space, and that means there is a less risk that someone will be exposed to the virus. So you using the nose mask you are actually trying to help other people, because because we've learned that 40% of the people that are infected with this virus that is caused by COVID-19 may probably have no symptoms. Most people are asymptomatic, But when they talk, when they cough, or when they sneeze, they can still spread the virus to other people in form of different respiratory droplets, which is expelled into the air. And those droplets can evaporate into fine particles that may linger for a very long time. So the function of the mask is to trap these larger particles. So they trap them before they can evaporate. And so the wearing a nose mask can generally prevent that. And also, in this place, for example, it's been mandated to wear nose masks. So you can't go out without putting on a nose mask, and that has actually been able to pull a lot of results.
Okay, let me cut you in now. So impaired cognition and restriction of airflow are some of the adverse effects of the long use of the masks. Can you explain these, please?
Wearing masks can maybe, for some people it might be the case, but for some people it might not. You know, there's been several studies trying to understand this, the prolonged effect of wearing a nose mask, you know. And I think most of all these studies conclude that you know, there is a little or no effect of an aftermath of wearing nose mask for a very long time. However, you know, they've also understand that there are some people that have problem with breathing, that have difficulty in breathing, or probably children that are less than 2 years old, or people that are unconscious or incapacitated, you know. So this kind of people will have to be exempted from wearing a nose mask, because these are the kind of people that have all these kind of impaired functions, and maybe people that have to wear nose masks for a very long time because of the nature of their job. For example, the doctors and the nurses that are taking care of the coronavirus patients. So I think generally, if you are meant to be wearing nose mask for a very shorter part of the day, like maybe when you're going out to the groceries, or you're going out to the movies or something like that, I don't think you will be exposed to all this kind of adverse effect. But when you are going to be wearing for a very long time, then it becomes a problem, you know. Then you have issues with breathing and all these prolonged respiratory problems.
Thank you so much. Wish we could hang out some more or talk some more, but time forbids. We'll have to go now. Thank you so much, John Adegoke, all the way from Melbourne. Appreciate your thoughts. You take good care.
Thank you.
And that's our package on today's edition of COVID-19 Myths and Facts. Thank you so much for watching. Now remember, whatever you do, stay informed and do stay safe. Bye for now.